During about this time, May 16, 2020, ito na yung kasalukuyan na merong lockdown sa Manila and Makati. So I made this PowerPoint para sana i-show ko kila Nery and her daughter, si Luisa. And then, I wanted to show them this, pero first of all, noong 2016, first time kong umuwi ulit sa Pilipinas after siguro mga 25+ years na hindi ako nakauwi. I think it was almost 30 years na hindi ako nakauwi. So it was during that time na yung situation pala ni nanay is already worse. It's really bad. Doon na nagsimula yung ano niya, naging worse na yung kanyang dementia. And I will explain to you later on kung ano nangyari. So when we arrived, everything was not good. Like lahat yung the way she was living, hindi na maganda yung situation niya dun sa room niya, which is yung current na room niya ngayon. So what happened was I've researched different hospitals to take her. So ang una kong hospital na I picked was the Makati Medical Center. So we brought her there. Kasama ko si Wilson at saka isang yaya from a kapitbahay. And then I didn't like the doctor that I picked. Parang ano siya, he's not really an expert when it comes to to sakit ng mga elderly people. I think he was an expert, or he has an expertise in cardiovascular medicine or something. So I wasn't satisfied. Doon ko sana siya ipapa-check in and then, get some diagnosis on what's going on with her. But I decided not to, so I did more research until I found Dr. Dumlao, Dr. Lourdes Dumlao, who is a geriatrician. Geriatrician is geriatrics. It means elderly people. So ito yung opposite ng pediatrician, which is medicine in taking care of kids, of children and adolescents or something. So I was satisfied kasi nga I have to get a professional who is really an expert in this field, sa pagtingin ng pagdiagnosis ng mga sakit, ng mga typical na mga sakit and condition and health conditions ng mga elderly people. So I brought her sa St. Luke's Hospital, Global City. I had her checked in sa hospital, and then they did a lot of tests, cognitive tests, evaluation. Gusto nilang ma-find out kung meron siyang depression. They did a cognitive test, a simple test para malaman kung kumpleto pa rin yung pag-iisip niya, kung they ask her kung anong date ngayon, kung where were you born, what year was you born, something, name your children, and etc. etc. So, and they also did some CT scan, MRI scan, and then dun sa MRI scan niya, it finally showed na meron siyang dementia, which everyone was really suspecting na yung kasi nga she started being forgetful when she was still in Israel. I think there were times na she was going back to Israel from Manila, and then she would lose things, nawala niya yung laptop computer on her way to Tel Aviv. Those are the signs na talagang like they deteriorate na yung memory niya or yung judgment niya is really getting bad. So it showed dun sa CT scan na she's had multiple mini strokes sa brain niya. So that is an indication of her disease, which is vascular dementia, in which I'm going to explain exactly what it is. So this part here, COVID-19 at mga magiging epekto nito sa pag-aalaga natin kay nanay. So I'm gonna start. So yeah, this is an address to Luisa and her. Okay, so I just want to say during this time, Nery was getting really agitated. Gusto niya nang pumunta sa bahay nila, kasi I think it's been 2 months na hindi siya nakapag-day off and she hasn't seen her family. So I was trying to point out na hindi ako ang kontrabida kundi yung COVID-19 kasi nga everyone was affected. Then here I go. I was going to explain like very well kung ano yung sakit ni nanay. Because I suspect na they don't really know kung ano talaga yung sakit ng nanay ko. And then secondly, this is how I'm going to I guess reiterate o ulitin ko ulit yung type ng pamamalakad ko as the bagong SPA holder sa business ni nanay. Third, I was just going to explain kung ano ba talaga yung COVID-19 because mukhang sa mga sinasabi sa akin ng pinsan ko, mukhang she doesn't really know a lot. That's why I was really getting concerned. So every day I would monitor them. Every day I will send them notes and instructions on what to do. When they go out, when they come back, kailangan alisin yung mask, kailangan maghugas ng ganito, blah, blah, blah. And then I went on to the number 4, which is ano ba mangyayari pag tinanggal na yung ECQ, GHQ, whatever that is. Because during that time, wala pang COVID testing, wala pang COVID-19 testing. So, no, I mean, meron na, pero it's only available to healthcare workers and I think people in the government. So it's not open yet to the public. So kung gusto mong magpa-test ng COVID-19, you cannot. So I just want to reiterate na bukod sa may type 2 diabetes, may dementia din na ang nanay ko. Ngayon, I made this in May 2020. Was it May 2020? So now it's December. So before mag-December, around November, that's when her blood pressure skyrocketed. Doon napansin talagang tumaas na yung blood pressure niya. And I'm gonna explain later on kung paano nangyari at kung paano namin na found out. Okay, so maraming ang dementia is like the general term for this disease. Yan yung parang pinaka umbrella name. Okay, I'm just gonna make an example. For example, yung cancer na sakit. Cancer has many different types, di ba? Merong liver, merong colon cancer, merong blood, which is leukemia, and so on and so forth. So ang dementia is the same thing. There are over 400 different types of dementia. Now, I'm just gonna explain yung 4 or 3 types, but I'm just gonna stick maybe to between Alzheimer's and vascular dementia. So Alzheimer's is the most common. Ito yung parang most people will have this. Especially, I think it happens around, I don't know, maybe about 50 plus, and then it goes on. Typically, this is hereditary, and sometimes I think it's I'm not really sure, but I think it's during it could be attributed to like bad health, not having a good diet and whatnot. So ang Alzheimer's this is the most common. Merong growth ng abnormal proteins in their brain na nagda-damage sa brain nila. So ito initially unang-una it will affect yung thought, pag-iisip and memory. And remember, and then it progressively causes failure to all bodies. So remember, our brain is the main computer of our body. Ito yung nagtuturo kung it will tell your body kung gutom ka na, kung busog ka, kung gusto mong dumumi, kung gusto mong umihi. This is the brain. We all know that. That's the main computer of our body. So, ang Alzheimer's is typically diagnosed with mild dementia stage. Pero, okay, I think the most important thing here is that after a diagnosis of Alzheimer's, a patient is given a life expectancy usually between 8 to 12 years from diagnosis. Pero however, it can kung the patient is really fit and healthy, they can even live longer. Pwede pa silang mabuhay beyond 12 years, maybe up to 15 years, as long as they are healthy. Sabi nga dito, in one American study, people lived from between 1 and 26 years after spotting symptoms. After the first diagnosis ng Alzheimer's, some patient can live, pwedeng mabuhay up to 26 years. That's Alzheimer's to you. And then there's this other one, it's Lewy body dementia. Ito yung merong slight Parkinson's, yung nanginginig, yung nagsishake ang buong katawan. That's the second one. Vascular dementia. This is what my mother has. Ito yung disease ng nanay ko. Kasi nga, like I said, after nung MRI scan niya, it showed na nagkaroon na siya ng mga multiple mini strokes sa loob ng brain niya. But the thing is, ang sabi dito, upon diagnosis ng isang vascular dementia patient, they are usually just given a life expectancy of around 4 years, 4 na taon lang, or up to 7 years, up to 7 taon. Pero however, sabi dito, sudden severe deterioration can happen. Biglang lalala pag nagkaroon ng further stroke. Kasi nga, ang vascular dementia is based sa stroke. Vascular is like a science term. Doon ito yung system na nagsusupply ng mga blood and I think other proteins in our body. So pag ito naapektuhan, nagkaroon ng shortage flow of blood in our brain, doon nangyayari yung stroke. Ang sabi din dito, the symptoms may be steady for a while, steady lang, okay lang, and then suddenly magiging bad, magiging maluha. And then susunod will be a period or time na magiging stable yung patient. Kasi this reflects, ito yung when the blood clots interrupt the blood, kung pinipigilan ba yun o ini-stop yung flow ng blood to supply the brain, therefore causing damage. So unfortunately, all dementia diseases, similar, pareho ng cancer, they're all considered terminal. So what does that mean is, right now, just like cancer, there's no drugs to cure it. Walang gamot na pwedeng gumamot sa or mag-stop ng progression ng dementia. Merong mga medication, merong mga drugs na nanay is taking, but those drugs are only to parang slow down, It only slow down the progression of dementia. Hindi mo na pinapalala. Yun ang function ng gamot. One of them is a patch. Nilalagay sa part ng body niya. And it slowed down. So pinipigilan niya yung pag-progress na But in reality, there's no cure. Pwedeng mag-turn left paminsan-minsan, turn right, but it's still gonna go on, like continuously go on. Hindi pwedeng mag-reverse. Kasi it's so funny. One of the wife of my brother says the last time sa group chat namin, na sabi niya magaling na raw ang nanay ko. Because daw she can remember memories when she was a child, when she was a teenager. The thing here is, we humans have this thing called short-term memory and long-term memory. Long-term memory are those memories na stuck sa brain natin when we were still young. Like, for example, we have memories of, siguro when we were, 6 or 7 years old, eating ice cream, all those things, making mano to your lola and all those things. Or things or events that happened sa buhay mo when you were in your teenage years, when you were in university. Somehow those are still stuck in your mind. Now, keep in mind, ang long-term memory natin is like, it's stored in our brain, Pero just like a computer, sometimes you have to delete some of it. And our brain, it automatically delete long-term memory natin, maski hindi natin gusto. Hindi tayo pwedeng pumili kung anong long-term ang memory that we can keep. So automatic yon, nawawala yung mga long-term memory natin. Sometimes, that's why sometimes we feel, how come bakit hindi ko ma-remember yung nangyari sa akin nung high school or nung elementary? Because that's what happened. Our brain, yung utak natin, automatically nagdi-delete ng mga long-term memories sa loob ng brain natin or in our mind. So that's how it is. Hindi tayo pwedeng mag-choose kung anong happy memory or bad memory ang ikikip natin sa brain natin. So that's what a long-term memory is. The other one is short-term memory. Short-term memory is yung, I don't know, yung bang you still remember what you ate for breakfast. Alam mo pa kung ano yung inalmusal mo? Alam mo pa kung anong araw ngayon? Alam mo pa kung is it daytime or nighttime? You know, those kind of, like, yung bang mga time na you were so busy tapos you left your keys, you left your car keys around, hindi mo malaman kung saan mo na nailagay. Those are considered short-term memory. Now, kung the minute na you start having problems remembering, kunyari, what you ate for breakfast, or you start forgetting kung saan yung address ng bahay mo or address ng friend mo na madalas mong pinupuntahan noon, then that is a common sign that you may have a dementia. Yun ang common symptoms na meron kang dementia. Now, if you still remember kung ano yung nangyari sa'yo when you were still a child, just like nanay, she keeps telling stories yung, nagpunta sila ni tatang sa Dupinga, and then umaagos, kumukuha sila ng mga yantok together with Auntie Lita, I guess. They were swimming, and her father would be yelling at her, sinisigawan siya, blah, blah, blah. Those are the long-term memory, and those are fine. Those are okay. Kaya nga, the minute you start having problem with short-term memory, then yun na yun. You may have, or I think definitely you may have a dementia. So right now, her health is actually progressing, kasi there's several stages to a disease. I've spoken to her doctor many times. So ang sabi niya nga nung doctor niya, si Dr. Lourdes Tumlao, kasi after during the pandemic, so naghigpit na ako na hindi pwedeng daling si nanay sa St. Luke's Hospital for her monthly checkups. And then months even before that, even in the summer of 2020, yung kanyang medical checkup is now every 3 months. Before kasi it used to be once a month. So it's been reduced to every 3 months. So we have to stop that because nga may pandemic. I'm worried na baka kung anong makuha niya along the way papuntang hospital or whatever. So ang nangyari nun is nagkakaroon kami ng video call kay nanay, and then dun sa other end would be Dr. Dumlao, and then other end naman si nanay. So nag-uusap sila, kinakausap ni Dr. Dumlao yung caregiver ni nanay, which was Nery at that time. Tapos doon, back and forth, exchange of information, titingnan ni Dr. Dumlao, ilalapit yung camera sa kanya to see what she looks like, kung merong namamaga sa kanya, kung merong masakit and stuff like that. And then maybe a new medication will be prescribed, or babawasan yung medication or dadagdagan. So that's what's been happening. And sabi nga ni Dr. Dumlao, she was actually surprised na sabi niya, we've actually had a good run. Ibig sabihin sabi niya, yung case ni nanay talagang parang it's been good so far. Yung kasi ine-expect na yung worst, pero so far so good. Pero like what I said, dementia has nowhere else to go. Talagang doon din pupunta. Everything will deteriorate. And the number one that would actually kill nanay is infection. It can be from a common cold or flu, and also like UTI. And she's actually had a UTI because nga dahil matanda na siya, ayaw niyang magpalinis doon sa kanyang private part. So it's been a struggle kasi nga nahihirapan yung mga caregivers na linisan siya doon to maintain the cleanliness. So that's what's been happening. So So we found out 2 times na meron siyang infection doon sa private parts niya. So but now it's good. It's so far it's good now. It's better. The only good thing now is that lahat ng blood pressure levels niya and sugar are all stable right now. Because why? Because she's not eating anymore. And I'm gonna tell more about it sa next post ko.